Farah Hanan binti Sakariah with metric number 162792. I am year 2 student from School of Physics with majoring in medical physics. I am the presenter and editor of this group.
My name is Lim Ying Ying with metric number 163460. I am a year 2 student from School of Physics majoring in medical physics, and I am the presenter and writer of this group. We are from Group 5, and today we are going to introduce a rare type of disease called maple syrup urine disease, in short MSUD. MSUD is a rare autosomal recessive disorder that affects how the body processes protein. These amino acids build up and become poisonous, which can cause serious health issues. There are 4 main types of MSUD. The first one is known as classic MSUD. It is the most severe type, in which symptoms typically starts to show up in the first 3 days of life. Next is the intermediate MSUD. This type of MSUD is less severe than classic MSUD. Symptoms usually appear in children between the ages of 5 and 7.
The third type of MSUD is intermittent MSUD. Children with intermittent MSUD develop as expected until an infection or period of stress causes symptoms to appear. Compared to those with typical MSUD, those with intermittent MSUD can tolerate larger doses of amino acid. The fourth type of thiamine-responsive MSUD, it reacts to a restrict diet in conjunction with high-dose vitamin B1 thiamine therapy. How common is maple syrup urine disease? MSUD is very rare. It affects about 1 in every 185,000 babies born worldwide. When close relatives have children together or in societies with limited gene pools, it happens more frequently. For example, MSUD occurs in 1 out of every 26,000 births among Ashkenazi Jews, where community members often marry and have kids within their own society.
MSUD can be detected by urine tests, blood tests, and newborn screening. By urine tests, the characteristics of urine will become sweet and have a maple syrup odor. Leucine, isoleucine, and valine, these 3 branch-chain amino acids, are measured in urine samples by analysis. Increased values points to MSUD. Next, to measure the amount of amino acids, blood samples are obtained. Elevated blood levels of valine, leucine, and isoleucine bolster the diagnosis. Lastly, newborn screening. MSUD is a part of newborn screening programs in many countries. Newborn screening facilitates early discovery and enables timely monitoring and intervention.
MSUD can be treated with diet, supplement and medication, liver transplant, newborn screening, and early intervention. Reduced intake of amino acid, particularly leucine, valine, and isoleucine, is the goal of the diet. It is necessary to restrict food high in protein, such as meat, fish, cheese, eggs, lentils, and nuts. Next, taking high-dose thiamine supplementation, which is vitamin B1, is effective for certain types of MSUD. Branching-chain ketoacid dehydrogenase, which is BCKD, enzyme performance is enhanced by thiamine. In order to improve the elimination of harmful metabolites, L-carnitine supplement might be advised. For extreme cases, liver transplantation may be considered. The BCKD enzyme is absent from a healthy liver. It is not required every time, as liver transplants are only necessary in situations where conventional therapies and dietary change are not enough. Early diagnosis of MSUD is possible with newborn screening. Severe consequences can be avoided with prompt action. Close cooperation with dietitians, genetic counselors, and metabolic specialists is essential in the medical team.
In conclusion, organic acidemia or MSUD can manifest in different ways and have different clinical causes. The secret to an effective long-term treatment plan is dietary management. A new subject of adult management is emerging as therapy has improved, bringing with it new obstacles. Ultimately, new therapies are required to handle challenging cases more effectively, and prompt clinical diagnosis in non-classical patients continues to be a problem.